Hi, this is RxHelp, advice from a person on the other side of the pharmacy counter. This is part 2 of my acne video. I'm going to show you my application process that I do and that I would suggest. So, first things first, we're going to wash our hands because you don't want to wash your face with dirty hands because it kind of is counterintuitive. So, wash your hands for 30 seconds, nice hot soapy water. Basically, if you sing Twinkle Twinkle Little Star to yourself, you've washed your hands long enough. You want to make sure you get in between your fingers and, how you'd normally wash your hands. Alright. Another thing you want is a clean towel for your face. So you can use regular hand towels for your hands, but when it comes to cleaning off your face, you want a nice, clean, fresh towel. So I'm going to put that over here for now. You want a nice soft washcloth too. And then you're going to pick your face wash. Now, I would suggest that if you're going to be using a benzoyl peroxide treatment cream, if you're going to be using a salicylic acid treatment cream, I wouldn't suggest using a salicylic acid wash, because it's kind of double the exposure and double the dryness, as I believe I said in my first video. But because it is not bedtime and benzoyl peroxide will stain clothes, I'm going to use my non-benzoyl peroxide treatment cream. Now, I have a dermatologist prescribed cream, but let's just say this is your salicylic acid treatment cream, because the application process is exactly the same. So, I'm going to use my Neutrogena Deep Clean Scrub, which does have salicylic acid in it, but because this is non-salicylic acid based, I can use it. But I tend to avoid this if I'm doing my benzoyl peroxide cream at night, because it dries it out. At nighttime, I tend to use my little Cetaphil cleanser that I get from my dermatologist, because it's very soothing. So, get the water nice and warm. You don't want it hot, but you want it to be warm. And tie your hair back if you're a girl, because when hair gets in your way, it's annoying. And then you get all the cream and stuff all over your hair. So, wet it with nice warm water, and you're just gonna kind of wet your whole face, doing a scrubbing motion, try to lift some of those dead skin cells out off your skin. And just make sure your whole face is pretty much damp. Put that aside for now. Now you're going to take a pea-sized amount of liquid, and that should be enough for your entire face if it's a salicylic acid cream or base wash, because it's going to foam up. Now the Cetaphil, I need about twice that much to cover my whole face because it doesn't lather up very well. But you're going to turn the water back on, put a little bit of water into your hands, and start trying to work up a lather. You'll know when you get to the right consistency, because it's going to be very, very bubbly, and it's going to foam up in your hands really nicely, like that. And then keep the water running, because you're going to be rinsing your face. And just I always start from my forehead. And I go in a circular motion to help exfoliate the dead skin off of my face and get rid of all of that. And I kind of just work my way down the side of my face, and then I go into my cheeks, across my nose, and then I pucker in my lips and I go over them, because you do not want to get this in your mouth. Not only does it taste bad, but it's not good for you to swallow. And so then I just go over my whole face with both of my hands and just kind of rub it in. Sometimes I go under my chin if I have a couple little breakout spots there. And try to avoid your eyes too, but get in your eyebrows, because pimples tend to like to go in the hairline. So get as close as you can as your hairline and get your eyebrows too. Rinse off your hands. And now you're going to take your nice clean soft washcloth again. Rinse it just so that the water is warm, because it's cooled down now and you want it to be warm. And then you just start to rinse it off. go in a circular motion again, and just basically go over where you went with the scrub or wash. Another thing I would suggest is I would also suggest doing this process after you've brushed your teeth for the night or morning, just because you get a little bit of the paste in the corners of your mouth, and that's going to dirty it again. So just start with a clean face. So just make sure you got all of it. And then this is the point where I also usually rinse out my ears, or if it's the morning, that's where I rinse the sleepers out of my eyes. Okay, and then that's the wash process. So you can put this to the side. You can put your scrub or wash away. Now take your nice clean towel that you got out, and you want to pat dry. Don't rub, pat. Because really rubbing is just going to make it sore. It's going to make it a little bit oversensitive, and with the drying products, with benzoyl peroxide and salicylic acid and other acne creams, they can tend to be dry, so you want to avoid making your skin any more sore than it needs to be. So you're just going to take a little bit at a time. This is actually Differin gel that I use. Same amount that you used for the lather, a little tiny pea-sized amount. And you just rub it in. Basically go over your whole entire face. Usually I need a little bit more of this than I do of the wash to cover my whole face, just because I want to make sure I get it in. But start out with the pea-sized amount. You'll get used to how much it takes to cover your face, but I always start with a pea-sized amount because I'm not overusing it and I'm not wasting it. So again, avoid your eyes and your mouth. But you want to get as close to them as you can. You want to make sure you're getting your eyebrows and up along your hairline. So, on there. And then if you have any others, like right now I have one in the crease of my ear, and it's really annoying. So I take a tiny, tiny bit, and I just go where there's other random things. Sometimes I get them on my chest, sometimes I get them on my back. On the back it's really hard because it's hard to reach, but I just kind of spot treat over the rest of my body. But usually when I use the creams for my face, I treat my whole entire face because my face is usually a little bit bumpy. So, and at the end, when you're done, wash your hands very well. You don't want to get this in your mouth. You don't want to be eating it, drinking it, or rubbing it into your eyes if you have an itchy eye. So rinse your hands off really well, and then that's it for the application process. Now, as far as using the benzoyl peroxide in a safe manner to kind of reduce the redness and burning and everything, what you're going to do is the first night that you're putting benzoyl peroxide on, if it's the first night that you've ever used it or the first night that you've used it in probably over a year, you want to put it on for 15 minutes. You know, use the application process, leave it on for 15 minutes. 15 minutes later, wash your face off. The next night, you want to do it for 30 minutes. If 30 minutes is too much, then you want to back down to 15 until 15 doesn't burn. But when you increase to 30 minutes. The next time you're going to increase the time frame, you're going to increase it to 45. And you're going to do this until you reach an hour, and leaving it on for an hour doesn't burn. And then after you get to that point, you can leave it on overnight or all day. But I would suggest using benzoyl peroxide at night because it does and will stain clothes. And it's much better to stain pajamas or bedclothes than clothes you're going to wear for the rest of the day. I've seen people have the collars of their shirts all stained because they've used it on their neck and chest. So you want to make sure you try to use it at night to avoid getting stains on clothes that you actually care about, because it's going to basically bleach it. It's not going to be a stain you can get out because the peroxide is going to take the color out of it. Salicylic acid I don't believe does that, but don't mark me on it because I'm not sure. I've never had it happen, and I've never heard of anybody having that happen. So that's a good one to use in the morning or during the day when you're out and about. But, yeah, so, oops. So, main points being, wash your hands before you do this. Use a nice clean towel to pat your face dry after you use the scrub. Always go in circular motions to help lift the dead skin cells. And then basically just use the cream all over, or if you're spot treating, wherever you have those stubborn little pimples, that won't go away. And that's all that I have to say today. If you have any questions for me, please feel free to message me, leave me a comment below, or just send me a video response too. If you have any other issues that you'd like me to cover, things you've heard in the news or anything like that, just feel free to also contact me and let me know, and I can do a video on that for you. Alright, that's all I have for today. I hope this has been helpful to you, and I will see you guys next time.